Welcome back. You're watching KTN News Desk with me, Akisa Wandera. I would want us to now quickly cross over to the interview here, a conversation I will be having with Catherine Nyongesa. She's the director of the Texas Cancer Center. Thank you very much. Always a pleasure to have you here on KTN News Desk. I mean, as we head towards the end of the year, I would want us to quickly focus on some of the most important bits of healthcare in the country. And of course, we can't do that without focusing on cancer. Let's begin with your assessment on the treatment, the facilities, and whatnot that has been there in the country throughout the whole year for cancer patients.
First of all, cancer is the third leading cause of death in our country. And we diagnose about 40,000 new cancer cases. And out of these, we lose 28,000. So which means we are losing more than 2/3 of our patients succumbing to cancer as we diagnose them. And it has been quite a big challenge in our country because these patients seek treatment, and most of the facilities are in Nairobi. And you find like a patient can be treated at the Kenyatta National Hospital, can be treated in private facilities like the Texas Cancer Center in Nairobi. So it is a big burden that our government and even other stakeholders, whether private, should work hand in hand to see how, one, is to reduce the cost of treatment, and two, to improve access. And of special note, I would say the National Hospital Insurance Fund has assisted a lot of patients get access to cancer care, both in private and in the national public hospitals. Yeah.
So would you say that this new initiative by NHIF has helped reduce the burden for cancer patients from your observation?
Definitely, yes. I think it has increased access. It has, you know, like cancer care is quite expensive.
Yes, it is.
And most of these patients, by the time they are diagnosed, to reach a level of actual treatment, they've spent a lot of money because sometimes they're being treated for malaria, typhoid, you know, other diseases when it's actually cancer. So by the time it's actually confirmed that it's cancer and now you are ready for actual treatment, you find you've spent a lot of money and families cannot keep digging into their pockets. Yeah. It's unfortunate that some arrive at the clinic and they actually have never applied for NHIF. And you know, you have to wait for about 2 months for your card to be active to access treatment. And other private insurances may not actually cover pre-existing condition. So I will encourage members of the public to register, both if you can afford, also get a private health insurance, and at least minimum should be the National Hospital Insurance, so that we are all covered and you are not caught unawares.
Yes.
Because I feel pity when a patient comes to Texas Cancer Center and their card is not active. And you know, you are sick, you are in pain, you are a cancer patient, and you cannot wait for 2 months to access treatment using your card. So it's good, like people, maybe we mobilize more and more people. And I heard yesterday our president saying that they are actually going to make even school children, those above 18, to apply for NHIF. Just this is going to help in improving universal health care. And cancer is quite key, being one of the most common cancers. And you'll find leading is, number one is infectious diseases, including pneumonias, you know, GIT infections. Then after infectious disease, number two is cardiovascular diseases like hypertension, you know. So number three now down the line is cancer. So it is something that our government is actually taking quite seriously.
You started off by breaking down the numbers for us, and the number of cancer patients in the country seems to have doubled up over the years. What would you attribute this to?
One is the population increase. Our population is increasing every day. The second thing is awareness. People now are getting more aware that actually it is cancer. Before, they would think maybe you've been bewitched or somebody has, you know, or it's actually not cancer. But now it is actually true. When they test and confirm it's cancer, then you seek treatment. So number two is awareness. Then the third thing is that we have improvements in medical diagnosing cancerous lesions, and doctors and other medical fraternity are aware that actually cancer exists, and they now have a high index of suspicion to pick up these cancers when they occur. And then the other thing why we're having an increase in cancer is the lifestyle of people has changed. People are smoking, and now shisha is like the in thing. And actually, I'm just taking the opportunity to make an appeal that the young people should really try to avoid using excessive use of shisha, because this is tobacco and it's going to affect them in years to come. So lifestyle has also affected us, and industrialization. So we have a lot of air pollution. We also have new infections like HIV, some other viruses, which actually increase the risk of cancer. Yeah.
You also talk about cancer awareness. Do you think at the point where we are now, more Kenyans putting more effort in just walking into a hospital for checkup?
True. We have a lot of Kenyans actually coming to centers for screening. And we cannot screen everybody, but we say that if one has some unusual symptoms that you get treatment for and these symptoms are not going away, you should seek a second opinion. You are being treated for throat infection, you are being treated for some ulcers that don't go away, you find you are losing weight for no apparent reason. I think it's high time, or you feel a lump in your breast or in any other part of the body, you have abnormal discharge, abnormal bleeding from any part of the body, just get to be checked. Because if your doctor is treating you for infections which are not going, request that doctor to refer you to a second opinion to another doctor, or if the doctor is not willing, then you can seek a second opinion by yourself.
So would you say that the approach is different from the Texas Cancer Center? What are some of the major contributions you've made to healthcare, especially with cancer in the country?
For Texas Cancer Center, it was started in 2010, so it is 7 years old. And over the period of 7 years, for example, in Nairobi, we have about 3 branches, one near State House, another one in Hurlingham, and the main one on Mbagathi Road. And recently, we started another branch in Eldoret. And I'll tell you, in 2010, we treated about 500 cancer patients. But over the years, the number has been increasing. And cumulatively, we've assisted over 11,000 cancer patients access treatment. So it's a major contribution, and just praying to God that Texas Cancer Center grows and offers more cancer patients treatment that is really needed. Because in the past, patients had to wait for over 8 months to get to radiotherapy. And that now has actually been with the starting of Texas Cancer Center, the waiting period has actually been reduced to just a week. So you can imagine within a week or days, a patient is getting radiotherapy. And cancer patients are usually in a lot of pain. They have tumors that are bleeding. And when you give them radiotherapy, they feel better. And the pain actually reduces, the bleeding can stop.
All right.
Yeah.
As we wind up, your advice to Kenyans this festive season?
I would say,
especially health-wise,
as we get into the festive season, we should avoid bad lifestyle, especially excessive use of alcohol and excessive use of tobacco, excessive use of shisha. And also, part of our Christmas gifts is that we have to invest in our own health. You should think of taking an insurance of some sort. As you plan for your kids next year, you are planning school fees, you are planning for your family, also plan for your family about health care. What insurance can you take for them? And obviously, keeping also a healthy lifestyle, exercising, using nyama choma to moderation, for example, people going for exercise, and also come early January after all these celebrations, if your patient has or your family member has any abnormal symptoms, even your parents, you need to take them for cancer screening so that we reduce the burden of cancer.
Thank you very much for coming into studio. Catherine Nyongesa is the director of the Texas Cancer Center in the country. Always a pleasure to have a conversation with you here on KTN News Desk. All right, that's how we wrap it up here on KTN News Desk. Many thanks for staying with us. We'll be seeing you once again tomorrow at 1 p.m. for periodic news updates. My name is Akisa Wandera. Have yourselves a lovely evening ahead.